This is your first adjustment today?
Yes.
No, not scary. We're going to take care of her. I'm going to have you start on your back for me. Let your chin go up. It's okay. Now relax your head. Relax. I got you. It's okay. There you go. There you go. You okay?
Oh, yeah. I'm good.
Your neck is like, where are you taking me?
It feels comfortable this way. Yeah.
I'm not comfortable. I feel like I'm out in the parking lot shoving my hand in the concrete. Like, concrete's like, no. No big deal. My phone.
Oh, yeah.
Oh, boy. Deep breath in. Gentle. There we go. I got you. There you go. I got you.
Ooh, I felt that one all the way down.
Woohoo!
And I'm very clumsy and fall. I'm trying for that. I'm talented, like I can fall upstairs.
Well, I'm going to make an excuse for you. Maybe, just maybe, because you have sciatica, because there's nerve pressure, maybe your body's not getting, your brain's not getting the input that it needs to
I'll
know
take
where
that.
to know where it is. You're not clumsy. You have nerve pressure.
I'll
I'm going
take
to
that.
give you an excuse.
I've been like a
Everything?
history, kind of everything, because I was a baton twirler for, oh my gosh, for what, 20-something years. So it's like when I stopped, everything kind of started hurting.
Okay. All right.
So,
The biggest thing bothering you is,
lower back, probably the main one here.
okay.
And then I have shoulder pain, which causes some pinched nerves every now and then on the
Okay.
right, just on the right side.
Okay.
And then I exercise a lot because they try to get me to do physical therapy for the back to strengthen the back muscles. And I just didn't feel like going to physical therapy, so I try to do a lot of like workout stuff every single week to help with it.
I'm very curious about those, sometimes the strengthening notion that, not saying that muscles can't give stability, I just wonder how effective it can be long term.
Right.
If I ask a muscle to be the thing that gives me stability, when muscles can fatigue, how long can they do it?
Right.
And so at the same time when you're strengthening your muscles, you're also putting stress on the joints and the discs. And if we haven't taken a picture, we don't even know if we do have a disc injury. But when we have numbness, especially in the hands, it's pretty much only caused by disc nerve pressure.
Right.
Do you have any symptoms like that? Nothing down the leg, no shooting, no burning?
No,
Okay.
the only thing I have is it's been going on for a while, but like my hip pops when I do certain leg work. So,
Okay.
but that's about it.
Would it pop repetitively or just one time?
Repetitively.
Uh-huh.
I don't know if it'll do it for me right now. It's not doing it
It's
right
okay.
now, of course not. Yeah, no, but it would pop really like loudly, thump like
No
crazy.
pain would it just kind of loud and
It would hurt when I
Uncomfortable.
did it, and then it'd go away.
a repetitive pop is not air bubbles, it's a tendon. You're having a tendon rub over a bone. So sometimes the position of the hips, if they're more, so because you sit for a living, you do a lot of driving and sitting, the hips rotate forward, and then when you move your hip around, because it's not where it's supposed to be, the tendons sort of get plucked, and then that's what's causing the clicking is, and so part of that is opening up the hips, they call it like tree, one of those tree pose in yoga, where you're trying to get your knee down, or the butterfly stretch,
I stand like that a lot.
those would be the way to actually open up the hips, and usually that resolves it. The more, if say everything gets inflamed, then the tendon's actually larger and then can get plucked more easily. I'm not over time, the tendons are like turkey, like if you ever eat a turkey leg, I mean, those steel cables in that tendon you're not biting through them, they're pretty tough. What ends up happening is if you repetitively, you'll get tendonitis, the tendon gets inflamed. I mainly care about the joint, the cartilage in the joint, and that's all dependent on the lower back. So the lower back pain can influence the health of your hip sockets. How long have you felt that lower back discomfort?
Very years.
Years,
Very
okay.
long time.
Just look straight forward for me, you got it. Okay. Just deal with about an inch forward, your head's forward. The sway in your back here has gone pretty straight, right? So there's not much arch throughout the lower back. It's not supposed to be bubble butt, but we're supposed to have some sway in our back. What happens is when we sit for a long period of time, that sway just becomes, just doesn't, we lose it. And curve is like a currency. It's, there's only so much you can have. And so when you lose the curve here, it goes into an accentuated curve in your upper back. That's what makes the head go forward. Our posture changes. So in order to get the curve back to your lumbar, we're going to need to reduce some of the curve in your the excessive curve up here. Does that make sense? To induce some curve in here. And then I know you drove a lot today, so we're going to try to teach you some stuff while you're driving to maintain that curve in your spine. This is your first adjustment today?
Yes.
No, not scary. We're going to take care of her. I'm going to have you start on your back for me. When you're bending, you don't get to choose where you're bending. If your lower back is the primary part of your back that bends, that's where you keep on hurting. So the adjustment is a way to change or reorder which parts of your back are the loosest. So we're going to adjust your middle back, adjust your upper neck, and try to take the stress off the areas that are overstressed. In and of itself, adjustments don't change posture. We have to mold and stretch. It's a tool to make the spine limber so that we can get the curves back to your spine. Pain is a call to action. Your body is trying to say, look, something's wrong. Okay. Pretty gentle. Deep breath in for me, and then head back for me. Let all the air out. It's okay. There you go. Here we go. Here you go. Good. Deep breath in. Move good. Head back for me. Let it all go. There we go. Let it go. Beautiful. Deep breath in. Perfect. Exhale. Beautiful. All right. Slide down for me, and on your side facing me. Take a deep breath in for me. And exhale for me. Exhale and twist. There we go. Left side for me. Good. Being your first adjustment is like saying this is the first time brushing your teeth. That's how, like, how is it possible? How have you made it this long? You know, I'm surprised you have made it this long without somebody working on your spine. Deep breath in. Exhale. Let's go face that for me. So, the most surgically operated on joints are these last two guys down here, called lumbar 5 and lumbar 4. The sacroiliac joint is this large joint, 3-4 inch long joint that nobody really has surgery on. And so part of the reason why these have all the surgery is because the joints in their surrounding area are working less than they're supposed to be. So the goal is to loosen up and restore as much function and lubricate these joints around to take the stress off the ones that are having the most stress. There's a lumbar curve called the lordosis that allows the weight to be evenly spread over all the segments. So when this curve goes straight like a ladder, all the weight ends right there.
Okay.
at the lumbar 4 and 5. Now the local pain is the joint. So we have the knuckles in here called facets. When you bend backward, they compress. When you bend forward, they open. Now there's a ligament that wraps that joint that holds it together. So when you bend forward, they actually destabilize because they don't have the surface area overlap that gives them stability. So then the muscles actually try to work harder to hold everything together. And so someone took that and ran with it and said, so it's the job of muscles to hold it together. It's like, no, the curve was supposed to hold it together.
Right.
Not the muscle being the thing that holds it together. The alignment is what gives you stability. Yes, muscles can give stability if you're in the wrong position. Muscles can aid that ligament in holding it all together, but that's going to cause a lot of lactic acid, a lot of soreness, and the alignment increases the amount of stress. And then over time, if that pain stays in there long periods of time, eventually the bone grows. Okay. That's the point I'm trying to make here, is that the pain has an acid element to it. So I think of it like love bugs do your paint of your car, or bird poop. Right? It eats away at the paint. If you leave acid around a joint, or like acidic foods to your enamel, right? It eats away at the enamel. In the same way that the lactic acid does to the joints, it makes the joints grow. Acid is negatively charged and calcium in your blood is positively charged, and so it actually gets drawn out of the blood and then makes what we call bone spurs, right? And probably you've heard of bone spurs and you go, oh, that's bad, right? So if these joints grow, do you see how the nerve coming through that hole can get pinched? And that's what then gives you symptoms down the arm or down the leg, is when there's, at your age, very likely it's more a disc injury, not so much bone growth. So your default is like your chin is tucked. I was like, part of it is retraining you a little bit and letting it be okay that your head is, you're looking straight forward, or even letting it be okay that your head or goes back and the bones go inward. So when you tuck your chin down, the bones go posterior, so they go backwards. Does that make sense? Mm-hmm. When you bring the curve in, they actually slide forward. And so when I feel your neck just statically here on your back, there's a lot of posteriorness to the bones, meaning that your neck is naturally inclined to being here. Have you ever noticed this big bump on the right side of your neck here?
Yes, I have.
Okay. All right.
I feel that.
Okay. Yeah. It has to do, I think of it very similar to crashing your bicycle as a kid. the handlebars and your tire don't line up, right? So right now I have your tire straight, but your handlebars are crooked, right? So now if I try to make your handlebars straight, now your tire's crooked, right? So I want them both straight at the same time. I'm going to show you. I'm going to make the bones level. Right about there. Right there, your bones are level. But I had to tilt your head 30 degrees right to make your bones level.
Yeah.
So give me the cliff notes, Ed. What does this mean? It means you're going to have, which was the left hand? No, the right hand had tingly.
Yeah.
Right hand had tingly. So so you're in more the early stage. You're in what I call right avoidance right now. When you tilt your head left, you have an injury, probably a disc injury on the right, and so your body's going, oh, there we go. You don't have what we call the compensatory pain, which is the left side is going to get damaged because your body's throwing the weight onto the opposite side. If you follow me?
Yes.
So the left lower neck, it'll start, Ed, it was my right hand when I was 29, and then it became my left hand when I was 35. It was one problem that was just the hot potato was moving around. Your problem is your upper neck is not only stiff, it's misaligned. Relax your head. Let your chin go up. It's okay. Now relax your head. Relax. I got you. It's okay. There you go. There you go. You okay?
Oh, yeah. I'm good.
You did good. All right, each other, real gentle. Here we go. I got your head. Same thing. Just relax your neck. I got you. Let it go. There you go. Very nice. Okay, give that a second.
I feel.
Great. It likes to pop by itself a lot, so
All right, we're gonna.
yeah.
We want to make it the upper neck do as much right here. Wow. This knot right here. There's going to be a mark here. Oh. There's gonna. So because the bone isn't in the right place, the muscles are doing a lot more work. So that's what I mean by the mark. The mark is the evidence of the acidity, the lactic acid that this area is going to accumulate because of the tightness, because of the misalignment, because of an injury that you batoned, somebody whacked you over here and your head went left.
Probably.
Is that constant?
Uh-huh.
Yeah.
Right hand, I got you. You're right-handed.
Mm-hmm.
You know, so maybe to avoid being hit with the baton, you kind of just have to tilt your head left. Do you have a baton with you? You don't have one?
Not on me now.
All right. What the?
Haven't done it in a
Maybe
long
that
time.
selfie stick or something. Wow. Just gonna.
Hi.
Yeah. Yeah.
I feel that.
Have you noticed this before me? You have a little bit.
A little.
Sometimes they get so stiff that you won't notice it because the sensors are based on motion. So what happens when we have an injury, it becomes tight, and so it's like a cast to a broken arm. You know, you just don't feel it until you take the cast off and then go, oh, there was an injury in there. And I've never seen the upper neck age at an accelerated rate. I've seen the lower neck age at an accelerated rate to a infinite level of times that almost like the movie Groundhog Day. Why am I the only one noticing that the day is repeating? And if you see, I gotta be careful with younger people. You know what I'm talking about, right?
Yeah.
Your mom noticed that. What happens is, you know, I'm getting these younger kids in here, and they're like Groundhog Day. I'm like, Bill Murray, 1993. No, not ringing a bell. And I got pretty strong thumbs. There's a lot of resistance.
I have like a high pain tolerance, so it's okay.
But it's like, you know, your neck is like, where are you taking me?
It feels comfortable this way. Yeah.
I'm not comfortable.
She's like, just
It's fine.
I feel like I'm out in the parking lot shoving my hand into the concrete, like, concrete's like, no big deal. My thumb. Right there, it's over here too. There's one on both sides, bigger on the right, but there's a little mini me on the left here. It's got a little bit of a crunch to it, a little bit of a, got it hidden in there. And I know all the hiding spots. I know all the. Let that go. Breathe. There you go. There you go. All right, almost there. Come on, let it go. Chin up. There you go. Good. We got it. I mean, that wasn't that hard, was it? I mean, it was. Right? You okay?
Yeah, not fine.
No, you killed me. I mean, it's
terrible.
just extremely gentle, and it's pouring out of here. It's
These are your souvenirs to go home with.
Mhm. Okay. You're fine. There we go. The mark comes out because of the muscular tension, because the bone is not in the right position. So if I asked 100 people, does inflammation have a positive connotation or negative connotation. I think most people would say inflammation is bad,
Yeah.
right? But I liken inflammation to like road repair crews, right? They're trying to replace the roads and speed up. You're trying to fix the roads, right? Do you want to drive on pothole, broken road? No. Now, hopefully they do it in the middle of the night, which your body does try to do. There we go. There we go. We're getting there. Nobody's really ever put your neck in this position before, right?
No.
Yeah.
Mm-mm.
This is home.
Oh my. Oh wow. You got a lot of souvenir to take on.
I had a feeling.
It's just the first pass. This is like running a, it's like you hadn't vacuumed your car for 30 years. Just a lot of, I'm not washing on that. This is like surface level. I'm just hovering the vacuum over. Jeez. That's good for a first visit. All right. Yeah, right there. Wow. I'll come back to it, but yeah, it's. There's no normal spasms. There's no normal inflammation or soreness or tenderness. There should be nothing. You should just feel pressure from my elbow. Try to let that shoulder relax. Yeah, it's tough, I know. Right. Right there. No big car accidents, no bicycle falls, no.
No.
Mhm. Falls off a trampoline. Maybe.
No. Surprisingly, I'm a well-balanced person.
Okay, not crashing.
Surprisingly.
I learned to rollerblade with a pillow strapped to my butt. My dad didn't want us falling on our butts. Go. All that marking that we saw on your neck is why the lower neck is overstressed. So the upper neck is clogged, the lower neck is doing triple of what it's supposed to do, is inflamed. The nerves that leave your lower neck go to your shoulder, go to your hand. So it's not about let's try to rehabilitate your lower neck. It's about let's put your lower neck on a vacation. Let's take as much stress off of it. Not let's try to retrain on how to work harder. It's like what? Let's have you pedal bicycle pedals with your hands. Yeah, so we strengthen your rhomboids. It's like, no, that just further upsets and stresses the lower neck more. You know, get the alignment fixed, and then most of these problems dissipate and go away. We weren't guided on how to where should my head be? Where should my posture be? Yeah, I see some salt bath in your future. Salt can go from Mexico. Our generation had more phones, and the younger generations even more, and the sitting, and we've had iPhones for 15 years now. So, you know, in your formative years, we sat and looked down a lot more. I mean, heck, you go to Disney World, you go to the mall, everybody's hunched forward looking down at their phones. When the clay was soft, you were in that position. So it's less impactful if you're older and you start doing that, right? Because it's already had a good foundation of stability. But then while we're growing, we're putting kids in these positions, and it's just disastrous. It's a really big problem in America right now. We're calling it the new smoking. No, it's been guarded for too long. Let that go. Didn't do softball or anything? No softball pitching? Just the batons. I guess the baton had to be enough, I guess.
I did like softball, what?
Did you do?
A long time ago. Not long though.
Okay. 'Cause this is reminding me of some of the builds of my softball players.
I think it was shortstop. That was a very long time ago.
Maybe the baton twirling might just exercise the same muscles.
Yeah, I've always been very flexible too, so.
With the rotator cuffs, I'm saying, you got teres minor.
I did a lot of like tumbling and things like that with it, so.
These are
Tumbling and dance, or gymnastics and dance.
Oh, there we go. There we're getting to it.
Splits, back bends, you name it.
And you can do all of that with the baton twirling
Yeah,
too.
it's all together.
Yeah.
I can't say it now, but I
Right.
used to could. It's been a while.
1 baton, 2 baton, 3 baton, 4 baton.
Yeah, my cousin, actually, she's starting to do it now, so it's
Okay.
kind of nice to carry that tradition on with her, so.
Wow.
Like, she was
Mhm.
the child, like, she
Mhm.
could be doing like this muscle,
Yeah.
and muscles were rippling.
Correct. Yeah, I know.
It's like, it's just the way she is.
No, it's core flexibility now. A lot of people in America are trying to go down the power spectrum, and I encourage the flexibility, angle. Try to get your back flexible so that it all works evenly as a team. When things are powered and stiff, they don't mechanically pivot.
Yeah, so my shoulder, they told me a long time ago, they're like, it's inflamed.
Mm-hmm.
But I was too young to have surgery, so I probably won't ever have surgery on it. I just try
Good.
to do
You
stuff
wouldn't.
to help it.
The main thing with the rotator cuff is that we're really set up for injury with the rotator cuff. The more forward the shoulder goes, the more the tendons are held tight. And I think of it like a rope. If you have a rope and you hold it tight, it's easy to cut it, right? But if a rope is held loose, it's harder.
Yeah.
So the more forward your shoulder goes, the muscles in the back, they all get stretched out and held tight, and then it becomes easier to rip and tear the attachment or the tendon itself, or where the tendon attaches to the muscle. And so the alignment that you're in when you're doing an activity or when you have an injury makes the rotator cuff. Now, I don't feel like we really need to cry about the rotator cuff because it all is designed to replace. Unlike discs, unlike enamel, where there are structures in your body that don't replace that we can properly cry about. But now when you have an injury, another injury becomes easier to happen, more likely, because there's actually a weakness that really where the scar meets the normal tissue, it now no longer has the same strength that it once had. And so then it can get to a point if you repetitively injure something, I didn't do anything. I leaned over to grab something and my back went out.
Yeah.
Well, right, because there's been this history of subsequent stresses on the same areas, now there's increased scar tissue and an increased likelihood of further injury. Pretty bad right here, you okay?
Yeah, I'm good.
Yeah,
Mm-hmm.
I feel it. Yeah, that's all, that's probably where you tore in this in here. That's not good. That's just, it's like I'm doing therapy with super spinatus right now. You don't know. It was really bad. She's not telling you the whole story. I feel a lot of tissue for a living, okay? This is some mad tissue right here.
Was that the shoulder you hurt doing yoga in college?
Yes, ma'am.
Yeah, right there's a scar. That's
Yeah.
a scar. It's like when you run your hand over your skin, you could feel a scar. It feels different. So internally, our muscles scar up, our ligaments scar up, just like your skin scars up. You can't see it; it's underneath the skin, but you can feel it. If you go in there and feel, you can kind of has a graininess to it. The back of rotator cuff, so
Feels wonderful.
yeah, yeah, I'm sure. Let's check the tricep here a little bit. I got you. There we go. I got your arm. I got you. I got you. There you go. Yeah, a little bit in your tricep, but yeah, mainly super spinny has got busted up. I got you. Hey, relax your arm, I got you. Everything's in a state of waiting for something to happen. It's waiting to, it's like you're at attention and ready to be punched.
Yeah.
Everything's like, that's why I'm like, let it go, because you're like, everything's in guard mode. It's like, okay, what happened to you so bad that made you want to live the rest of your life in guard mode? That's why I can, again, muscle whisper, it was really bad. She's not telling you.
Yeah.
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 A little shock.
That's
No, I expected that.
That's about what it
actually.
felt like.
Yeah.
I have that poor right shoulder, and there's that injury over here. This is the joint right there. We want as much mobility back from these hips. Now I'm gonna check that. Like I said, the hip that we said was left hip that was clicking.
Yes.
I'm gonna check that in a second.
Yeah, I try to foam roll my hips sometimes.
Where are we at here? Number of food? This 5, 8. Where are we at here? What is this? Pain wise.
Oh, pain?
What is this?
It's fine.
Oh.
It's fine.
She ain't gonna tell us. Yeah, it's fine. Till my car gets keyed.
If it,
Right?
if it hurts really bad, I will tell you.
All right. How much pain there is tells me how much reluctance, how stiff the joint is, right? So if it hurts real bad, that means it's a lot of rejection.
I'm just slightly regretting my small leg workout earlier this week. So
Oh, right.
it's fine.
I should have done the leg day.
No, I
Where we
shouldn't.
had seen Dr. Ed.
Never do leg day.
Should have done leg day.
And it
Oh,
wasn't
not the
even a-
hammies.
And it wasn't even a bad one either. It was so small.
She's so tough. She ain't gonna let me show you.
She suffers internally. Yeah, we need one of them rollers leaning on the
Nice. Yeah, there we go. Extras. Extra. Read all about it. Okay, yeah, that was nice. Right there. So they should have already moved, right? Those vertebrae should have already moved 30 minutes ago. They needed a little bit of hand holding to get them to, work for us. Right, so that's why I adjust you cold, right? That's why I didn't massage you first. I wanted to get an assessment for how your spine moved essentially before we worked on you, right? That tells me how healthy your spine is and tells me how much of your back was operating before we went in here and cleaned. There's still some there that were, like I said, this area was a little reluctant. I got you real gentle. Here we go.
She's bendy.
Like how far are we gonna go?
Mom, not during the. That was good.
That means we can go further,
Yeah,
right?
Relax your arms down. I got you. Take a deep breath in. Exhale. Here we go. We're going a little deeper. Breathe. There we go. Nice. You okay?
Yeah, I'm
All right,
good.
you did great. May I have you on your back for me?
I try not to pop my toes today.
Ha! That's right. Leave them for me.
Yeah.
Somebody already took a bite of this cake. Huh? Relax. There we go. Is that your hip? I think it was. Was that down here? You think it's inside here? Jeez, I mean, there's a tight cable right here. I mean, that's just. There's no pain when it happened?
No, it just sounds like a.
Clunk. To me, do you remember when it happened? What part of the day? Was it the end of the day?
I do most of my workouts at night, so it's always in the evening.
I'm trying to say, if it's a long day of sitting, see my point?
Yeah.
Your hips are more forward, and then you go exercise with the forward hips.
I mean, I even did it in the past, like when I tumbled and stuff, I could, but
Feel it
it's not
clicking.
it, but it got worse.
Yeah, It's hard to say. I would think it's just a tendon snapping over a bone. If you feel that happening, keep working on opening up the hips. It feels like when I feel the hip joint, I don't feel any crunchiness or anything. It feels like the hip socket is very healthy. So, avoid your earring. There we go. All right, go ahead and tilt your head to the right a little bit for me. Tilt your head right. Okay, good. Okay. Go ahead and just, tiny ears. Tilt your
She
head.
does have tiny ears.
Tilt your head right for me. There we go, yeah. All right, go ahead and tilt left. Okay, up on the bottom. Go ahead and tilt left. Ooh.
That was a big one.
You hear over there.
Yeah.
Are you sure it clicked at? Oh, yeah. No, heard it.
Good.
This is the level of curve. This is the neck version, but the lumbar version is what you're on. But this is the level of curve that your back should have. This is home. 45-degree arch. It should feel like nothing because there should be no difference between where you want to be and where the mold is asking you to be. Therefore, it's easy.
Okay.
And so I have a little book behind your head. Is your hands going tingly a little bit?
They're okay right now.
Okay. If they start going tingly, move them to the side or back to your belly. Let's see. Let's test you out. Lift your head. There we go. There we go. All the way back. Let's go all the way back. There we go. And now we're at the floor.
Oh, we're at the floor. Oh.
We're at the floor now. I started you with a
Okay.
little cheater block. There's a range of positions. You have from the bottom of your shoulder blades to middle lower back. I don't want this all the way down in your lumbar where it's very loose. We're trying to focus the pressure on the parts that are tight, not the parts that are already loose. So we don't want to loosen and stretch the parts that are already like a piece of metal or a piece of paper. If you keep bending it back and forth, eventually it rips, right?
Yeah.
Or a paper clip. If you keep bending a paper clip back and forth in the same fold, you can just snap the paper clip, right? Because you weaken the metal by that hypermobility. It's the same thing that happens in your body. Continual hypermobility in one area eventually tears it up, rips it up.
How you doing?
I'm good. I feel a
Yeah.
lot looser.
You need a nap now?
Yes, I do.
Yeah.
Very good.
But no, thank
Thank
you.
you so much, Ryan. Very good.
Thank you.
Lower back and sciatica. How long have you been dealing with that?
Couple of years.
Okay. Anybody who diagnosed that, or you just kind of figured
That's
it out?
just me.
Okay.
Old age.
I got you. So,
And I do stretches for the sciatica.
okay. Have you had no? So I take it no pictures have been taken of your back, no MRIs or anything.
It's
Okay.
not been so bad I had to go to the doctor.
Okay. I think we went over just a tiny bit with your daughter about, the cause. So the sciatic nerve is made up of 5 nerve roots, 2 lumbar, 3 sacral. So these guys, if we took this farther, all these guys make a union here. So this nerve and that nerve and these 3 sacral nerves, they all come together and they form the largest peripheral nerve in your body called the sciatic nerve, and it's about as big as your thumb. It comes down across the top of the iliac crest here and down your leg. It supplies about 75% of your leg.
Yeah,
Right. Okay. So the sacral divisions, real quick, the sacral divisions don't change in size. Those holes are fused, and nobody really pays much attention to them because they are fused, and so there's not much that changes there. While the divisions in the lumbar change based on 2 things: the size of that disc, right? So as the disc, which is like enamel on your teeth or tread on your tire, if that tread gets thinner, then the hole becomes more narrow, or what we term stenosis. And then also mechanics. So I'm going to use this hole up here just so it's a little bit easier to see. When I bend forward, the hole gets bigger, and when I bend back, the hole gets smaller. So this leads to the explanation for why people, as they tend to age, we round forward. Because we're going into an avoidance, we're avoiding hence sciatica. You would have more sciatica if you didn't round forward. The joint has a lot of feeling, the nerve has a lot of feeling, yet the bone and the disc have very little feeling. And this makes it easier to just conform to being rounded forward. That lumbar curve, though, so when you round forward, there's an immense amount of pressure on the disc. So we call it the interdiscal pressure goes up a lot, and then that causes the disc to start bulging back. You're right in the middle ground between, you very likely have discs that are injured and there's maybe some bone spurs growing in there. Again, without a picture, it doesn't necessarily change my care, but to help with prognosis, most doctors would want to, let's get a lumbar picture, see what's going on. But knowing what I just told you, let's see what happens just moving some stress off your lower back. When I move stress off of something, I have to put it somewhere. And I don't expect the area that I move the stress to, your middle back and your hips, to just open arms, hug me, and really appreciate being told to work when they've been on vacation. So when you saw me doing some of that adjustments to your daughter, I expect some, and I didn't really like that very much, and so we're gonna try to loosen up this middle back a little bit. Anything else going on? Anything else, any headaches or?
No, during work, get tension in the neck, but
Okay. And you work upright a lot, sitting a lot? What would you say
I'm
majority?
walking constantly.
Okay. All right. And there's numbness currently or just intermittently?
I had a stroke on April 2nd, so I still got some tingly right here that's residual from that.
Okay. And tell me about that a little bit. We went to the hospital?
Oh, yeah. It was front left side here. My whole right side went numb. Lost sight in my right eye. It was crazy. Out of the blue. Never had any health issues. Just happened.
Gotcha.
Anyway, went to the hospital. They did my workup. Also found a blood clot here, hole in my heart, which they believe is what allowed the blood clot to go up to my brain. So I'm fixing to have heart surgery next month. So, anyway.
So is it the septum that's got is it a septal defect they call it? Do you remember what they said?
It is the chamber, between the two top chambers of
Right and left atrium?
It's in there.
Right.
And it's about a little over a centimeter in diameter.
Do they think it was there from birth or is it something
They
new?
think so.
Yeah.
They think so.
Yeah. Wow.
So they're just going to go in and cardiac cath and put a patch in there.
But they think the clot came from your leg? Or no?
We don't know.
Don't know,
There's
yeah.
no, but I did have one as they did my ultrasounds. It has since cleared up. I've been on blood thinners and cholesterol medicine to try and get rid of that kind of stuff. So anyway, my follow-up ultrasound, I'm clear. Follow-up with the neurologist, I'm clear. Vision's back. So now I've got to do my heart, and hopefully everything will be okay.
All right. You know, the only piece that I would put into that would be that, you know, when you have sciatica, it's more likely we don't move as much. Because I'm in pain,
Yeah.
I'm hurting, I don't feel like going for a walk, I don't
Yeah.
feel like going ride my bicycle, I want to just lay down or not move.
Yeah.
And so the more sedentary or the less we move, the more likely
Yeah,
those
that's
are to
it
happen.
will.
So those are interconnected, those aren't independent problems. And so, and the sciatica has been going on for 2 years.
Yeah, and it's not 100% all the time. I bought a new mattress, which has helped immensely.
Mm-hmm.
And like I said, I walk a lot. But it's like we're on vacation and we're sleeping on a bed that's
Right.
not ours, and it's like, okay, I can feel it.
Well, so like I said, it's sciatica for 2 years, and then this started with the heart 6 months ago.
Well, that was just in April.
So a few months ago. My point is that, you know, I don't find those to be independent.
Right.
Those are, you know, those. So the sciatic nerve also controls the muscle that's in the artery. So your difference between veins and arteries is arteries have 3 layers. So there's a muscle in the middle of the artery wall that controls your blood pressure. And so even the ability to form a clot, so we have sciatica, so we know, that's why you'll get tight muscles. It's also tightness in the muscle in the artery, which
Right.
can affect circulation and then even form the clots.
Yeah.
So
It is in that right leg too that I had the clot. So.
yeah, let's get the lower back happier.
Yeah.
And you know, I'm not saying you don't need yeah, there's a hole in the heart. I get it. You know, and it is interesting to me that this went undiagnosed for
All my life.
that's quite a while.
Yeah.
Keep the knees bent. There we go. Have you cross this arm under and over. Can you do a sit up? Is that okay? We'll sit up. I got you. Take a deep breath in, and then just relax. Let the air out. Real gentle. There you go. There we go. There we go. All right, deep breath in. It's okay. Head back from it. And all the air out. There you go. Let it go. There we go.
Oh, yeah.
Oh, boy. Deep breath in. One more. All right. Stay there. I got you. Stay there. Yeah, we got some resistance. We're gonna get moving. Scoot down for me on your side. I had some movement here, but I had pretty much
Yeah.
sticking his tongue out. Just gonna stretch for a second. Exhale. Just twist. Any pain when I twist you here? You okay?
Mm-hmm.
All right, deep breath in for me. Exhale. Exhale. I got you. Oh, it's okay. I got you. It's okay. Other side for me. It's a bit of a dance. We're dancing with the stars. Here we go. Ankle behind there. There we go. Deep breath in for me. Twist for me. Twist. There we go. I got you. Oh, it's okay. Face up for me. It's okay. That adjustment's a little bit. What do I say? We gotta be careful because your lower back is so eager to move, and your hips are reluctant. So what happens is there's a higher likelihood that just your lower back moves in that adjustment. So I needed to examine that, but I can feel what's going on there. I was asking your hip joint to move, and it was like no, and then the L5 was like I'll do it, and I'm like no, I don't want you to do it. I had a whisper moment with your hips, but You know, it's like the one that I didn't want to move was wanting to do it all. And so that's why we're here. You know, that's why the
I'm always
sciatica.
complicated. I can't do anything
okay.
easy, right?
It's okay. But I see what's going on there. We got to work those hips, though. Those hips are going to be sore. All right, let me see here. Just a little baby one. Little baby one on the right, very small. Okay, real gentle. Here we go, real baby. Here we go. There you go. Yeah. Very good. You okay?
Mm-hmm.
Yeah, very gentle. There we go. I got you. There you go. I got you.
Ooh, I felt that one all the way down.
Woohoo! Did you work before? Anybody know massages?
Massages, yes.
How often? Do you think?
Oh gosh, I've only had like
Intermittently?
3 in my life.
Okay. Oh, you guys. Any Listerine where it says, "Oh yeah, I think I gave me like a mint once." Okay. Same thing right back here.
Feels good.
Yeah, no, her neck's a lot softer than yours.
Oh, sure.
Jeez. That's saying a lot because you're the younger one here.
Yeah.
You're supposed to be softer. Why are you so stiff? Caught me by surprise a little bit. I was like, gee, your neck.
She stresses and anxieties and overthinks.
She's like, this
everything.
is not bad at all. This is just nice and soft here.
School's not in yet, just like.
Oh, okay, I got you. Catch her in a couple months, and
Oh.
I know. Yeah, your neck. Just trying to see if it'll tilt this way. We want as much range of motion and flexibility that we can restore to your upper neck. Again, this area doesn't have any surgery. It's a unique area that doesn't even have any discs to wear out. There's no tread up here to wear out. It's a unique part of your spine that if this area functions, it can take a lot of pressure. And even sciatica. So the more forward your head goes, the tighter your middle back becomes. Tighter your middle back becomes. That influences the nerves that go to your heart, but also makes your lower back overwork. So I don't.
And I'm very clumsy and fall. I'm praying for that. I'm talented, like I can fall upstairs.
Well, I'm going to make an excuse for you. Maybe, just maybe, because you have sciatica, because there's nerve pressure, maybe your body's not getting, your brain's not getting the input that it needs to
I'll
know
take
where
that.
to know where it is. You're not clumsy. You have nerve pressure.
I'll
I'm going
take
to
that.
give you an excuse that we
Because I'm very good at it.
we have things called proprioceptors, or position sensors that tell us where our body is, right? And so if those sensors aren't giving clear communication to your brain, then you fall because you don't have the input, and so obviously the last 2 years, the very least the last 2 years, things have not been good, right? So the nerve's literally screaming at you. So the health of your spine is your health. The nerves that go not only to our muscles and our skin, and also go to our organs. And we call these the sympathetic nerves. There are fight or flight nerves. They're the ones that originate from your spinal column. So if you're running from a tiger, you want your heart to be excited, right?
Right.
To beat faster. So they're the nerves that essentially increase, they're the gas pedal to your heart. They're the gas pedal to your lungs, right? Because you want your lungs dilated and intaking as much oxygen as it can. Does that make sense? They're also the brake pedal to your pancreas, let's say, right? Because you don't need to be, your pancreas doesn't need to be releasing, insulin when you're trying to run, necessarily, right? You want to shut down all the non-essential organs so that you can get as much blood flow going to the muscles in areas that need it. So it's the gas pedal to some organs, but it's the brake pedal to other organs. So when you have inflammation of your spinal column, essentially what can cause sciatica, you have other effects versus, that you can have, digestive issues. You understand? I have a woman with gastric paresis, for instance, and so the inflammation from her back, does that make sense, shuts down the stomach. And so when I work on her stomach digests, and then she is so thankful and grateful. She's like, Ed, after you worked on me, my back, my stomach, I was able to digest food again. I've taught her how to stretch at home and have it last longer, but the medical world doesn't connect the dots for people that spinal dysfunction, inflammation, causes organ dysfunction. Stress shuts down the calming nerve to your heart, called the vagus nerve, is the nerve that is the brake pedal to your heart. And so when we're stressed out, which we might have had a little bit of stress these last couple of years, so that shuts down the calming nerve, and so then our blood pressure goes up. And
I found the nut.
I know. Well, this is the other side, but both sides of your back ultimately can influence the heart. So this is not independent of your heart. All of the organs in the body other than the brain have no intelligence. The brain communicates that intelligence through nerves that leave your spinal column. So when we have organ dysfunction, sometimes the dots aren't connected. That maybe it's the communication line that's the problem, not the organ in and of itself deciding to go AWOL. You know, T1, 2, 3, 4. That mole's right at the bottom of the nerves that go to your heart. You know, this area has been a clogged area for a while. I would have made a modification to the body. I would have added another heart that pumps our sewer pipes, the lymphatics. If I could make a little, and maybe it doesn't pump every second. Maybe it pumps like one pump every minute. You know, but it just it helps to push the sewer pipes. But as is, the way it's designed, it's pumped by mobility. And so the tighter your chest gets, the more the sewer pipes don't flow. That creates a sedentarism, that stiffness creates inflammation, just allows it to just build up in there. All right, I'm finding, there it is, right about there's the limit. Oh boy, I feel a twitch. I'll get you, Ed. Both going to get into salt water, just soak 15, 20 minutes. Yeah, we're going to do a little more attention on this spot right here. This is the most direct, yeah. Feel that? Yep. That's the most directly responsible right there. I'm doing a round one on it, and now we're just going to do another round on it in a second, but it's right here. Right there's the most responsible for the sciatica. Biomechanically, this should function before your lower back. So this ultimately should be injured before your lower back's injured. So I'm kind of looking at the one who's the manager going, why aren't you working? Why aren't you injured? Why is just the lower back injured? Oh, because I gave all my work to him. Right, and so the lower back's been left holding the tab. Been there before, Costa Rica?
I'm sorry?
Been there before?
No, that was my first time. We had so much fun.
My parents travel more than we do as well.
We're working, we're young here.
I travel to the pool and like 100 feet from my house.
I got 4 kids. I'm just trying to lucky keep my head on straight.
Was Costa Rica beautiful?
Oh yeah, it's gorgeous. And it's actually what they say is wintertime or wet season, the opposite of ours. Their summertime's in like November, December, January. But there, even though it's considered wintertime there, I mean, it was still high in the 80s and humid and all that stuff. But we zip lined through the rainforest and
Fun.
took side-by-side four-wheelers up through the mountains and out on the beach and hiked to a waterfall. And
That's awesome.
it's not as pretty as here. The ocean water.
Right.
Now the Caribbean side, the eastern side, during their summer months is, but the Pacific side is just kind of drab. But everything, it's just so green and lush. And you have, everywhere you look, you have the mountains and the ocean and the forest. And it's just so pretty.
Right there, yeah.
I can feel it.
Oh, I knew it. I know. That's the cause of your sciatica. And the difficulty we're going to have is that we're going to have to start up here because you're not going to be able to handle pressure with that dendral here. So we're going to have to spend a month up here to even be able to get it. Or you have to have a lot of books behind your head. You know, maybe we can approach it with that, but she's going to need to have some stuff to prop her up. But you know, this is what you need right here. We're going to move the pressure point to right here. Sometimes you'll feel it in your leg when I push here. Sometimes people will say spinal cord actually ends right here. Well, hold on. I thought it goes all the way down to your tailbone. No, the cord, it becomes individual cables. So we call it the conus medullaris, this little bulge of the spinal cord, and then it becomes individual cables called the cauda equina, horsetail. So it becomes individual nerve roots, and then the nerve roots that exit down here actually originate off the spinal cord right here. I've had nobody really ever talk about that and the significance of what it means to have inflammation here. Is it possible that the sciatic nerve is actually irritated up here? Because this is really where the sciatic nerve starts.
No, I didn't
Right?
know that.
It starts here, travels down the tube, and then exits at those 5 nerve roots that I showed you.
I always feel it in my butt joint.
Right, I understand, but what happens, like I said, that nobody cares about what I think about. This is what I think about all day long. They're mine. But that this is the start of it, that inflammation here aggravates the nerve to its breaking point, that when finally it goes through its exit, it finally becomes a problematic. And that's what we sort of rely on too much on the imaging. But here's why I say this. I used to take pictures of people that had no pain. And you know what I saw? A lot of horrible looking x-rays and MRIs in people with no symptoms. Do you understand? Now, I don't believe many chiropractors or medical doctors know that because they only take pictures of people that are in pain.
Right.
Therefore, they think that whatever's on the picture must justify and be the explanation of the symptoms. Oh boy.
In actuality, it could have always been there.
Right. What about these 100 people here that have no symptoms that have terrible looking x-rays? Explain that one. Right? Well, but they don't have that data. And so what's your explanation, Ed? There's more to what causes symptoms than what can be objectively seen on an image or measured on a blood test. There's a soft tissue component, which is what the gua sha and what the Chinese sort of figured out, that you got to clean the tissue around the nerve, and that can't be measured on an MRI. This is what we were trying to adjust when you're on your side, was that felt lovely, Ed, I know. This joint right here, and I got a lot of slack from it. It did not like me at all, so now I'm going to win.
The elbow's gonna beat it into
Right
submission.
there.
Almost tickles.
I know, well, give me a second, it'll be pain. It'll be pain in a second, right there. There's your cause. That's at least, I know, I'm sorry. This is not gonna be, yeah. When I had you on your side, I felt it all. I saw the problem right there. This joint is much tighter than it's supposed to be, and it's offloading its burden to the segment right above. It's just hard to find somebody to help you work this joint, and it's hard to self-loosen this joint. It's not very, I have an idea, but even my best at-home treatment for this is not that great. It's hard. You have to really have somebody manually get a massage gun or elbow or manual work on it to release the stiffness that's in here, right there. Right there. I know. Sitting locks this joint, so this is when we're not really meant to sit for more than, I would say, 6 hours a day. Anytime you're over 6-8 hours a day of sitting, you're way in the red. She stays quiet, but she'll twitch. She twitches on us, but she ain't gonna yell at me yet. That's bad. That is a bad knot.
It hurts, but it feels good.
You got it. You need somebody. This has to be addressed. The sciatica won't go away until that rigidity here. Sorry. That's a tough one. That's a lot of buildup right there. They found within 10 days of a joint not moving that there's actually a measurable stiffness that can be measured, can be aspirated from the joint. Plaque, crystals, sandpaper starts to build up in joints that don't move. So essentially, motion is lotion. The movement of the joint is how it kind of lubricates itself and allows itself to stay supple. So it doesn't take long. I didn't do anything. It doesn't take long. One injury and you just don't move and sit too much and it just locks up. And I know, I'm sorry. I know. Right there. I know, I'm sorry. All right, fair enough. That's right there. That's where she's gonna want the dental roll, right here. Like we might have this, like I said, we might have to be on bra strap for a while, and then eventually be coming down onto this spot right here. But that's where we want to. Knees will be bent, and then we'll put our hands on top of our thighs and push. And I'll try to show you that in a second. When we're on our back on the dental, you can, especially for your mom, push on our thighs and open up those holes a little bit. I'm curious to see how much relief you get. You know, one of the ways this goes away is, Ed, I feel better, but I got to live on that dental roll. And then it transmits to, Ed, I can go 2 hours without being on it. Right now I can go 4 hours. You know, then the leash gets longer, and it's not just going to go from I'm dying till I'm perfect. It's not. It's a journey to undo it. And that just needs time right there. All right, here we go. Yeah. Oof. Thought you were done with that, Ed. No. It's another tool to hit it with. Right there. Oh man. I didn't even do leg day. I got you. Actually, there you go. Oh.
That was a good one.
She got
No pain.
Okay, actually, there you go. All right.
That knee just pops out easy.
Does it? Have you heard it? Have you hurt this knee?
Yeah, cheerleading years ago.
In here?
Yeah.
Same. How's it compare how it feels?
This feels easier.
Uh-huh.
Where this one, it's like I'm scared, like
Gotcha.
it's gonna pop out if I.
I mean, this you're not going to hurt the knee, but I would see, part of not being able to bend your knee fully is that meniscus is going to age at a faster rate, because the mobility of your knee is what brings nutrients into that meniscus, and the meniscus is non-sensitive, and until you have a problem, there's not going to be much awareness of it. But as a preventative, I would encourage you to try to find that limit, but you just try to push the edge a little bit. Practice. Well, not going too lateral like that, but you're just trying to make the that cheek, that one butt cheek go right to your heel. All right, have some fun. Go ahead and tilt your head to the right a little bit. Tilt your head right. Tilt your head right. There we go, a little bit. Here we go. Here we go. Tilt your head to the right. Here we go. All right. Go ahead and tilt your head left. Okay, no, nothing there. Go ahead and tilt your head to the left. Yeah.
I heard that.
You both got the upper ones. Some people I only get the lower ones. Some people. All right, breathe. There we go. You okay?
Mm-hmm.
All right. Start here. Easy. We can always make it more difficult. we always can go harder. It's just, I don't want you punching me. And like I said earlier, the faster we change things, it's like Inception. The faster you start changing the dream, the more your body's going to notice. So it's going to be a little bit harder. Use easier skin on skin at home, but you try to grab your thigh. You're just going to push. You gotta let that lower back relax. Push. Get the idea? You're trying to traction. I know it's hard. Get the idea? You're trying to push and open up that lower back.
Mm-hmm.
Get the idea? I know it's hard to, because your lower back is guarded. You're trying to push against a tight muscle, so you have to. It's more about also talking to your lower back and letting it go and letting it open up a little bit. Maybe daughter, you grab her thighs and just push them down.
I do do that sometimes.
You're trying to, it's hard, but you're trying to grab your thigh. You're trying to straighten your arms. I know it's tough. It's just tough to do. But sometimes I do a little bit of a wiggle at the same time. I try to, a little bit of get the idea? Trying to work the drawer in kind of idea.
Actually feels good.
Yeah.
You should open it up. It should give you it should open up. The mechanical part of the pain will relieve. Now the soft tissue is bruised, won't do anything, right? So the fact that you get some relief means that there is a percentage of it is the mechanical, which we could see on an MRI or an X-ray. You'd see the stenosis, which is causing the sciatica. I have people that do that and they feel no difference because the nerve is actually sitting in the acid, and so then it's more of a soft tissue bruise. even getting up. The rest of your life, no throwing your body forward. You roll to your side. Side
I
push
learned
up.
that with my stroke. Don't flip upside down, flip
Okay.
up.
All right.
Thank
Much-
you.
Appreciate
Appreciate it.
Thank you.